Hello, Brunswick County and beyond. Dr. James here with Coastal Integrative Health in Charlotte, North Carolina, and we're continuing our Pillow Talk with Dr. James. And today should be our fifth installment of Pillow Talk, and we're actually going to change gears a little bit. If you watched our previous videos where I talked about my favorite pillows, the ChyroFlow, Therapeutica, some that aren't so hot, and then getting into mattresses as well, pluses and minuses of different types. Uh, Today, like I said, we're going to switch gears and actually get into sleep aids. And going to get into some meaty materials here today, but oftentimes we have a lot of patients that are dealing with sleep issues that aren't necessarily related to pain. They're not related to neck, shoulder, hip, back, keeping them up at night. It's more of their brain being wired and they're just basically staring at their ceiling with their alarm clock. So if that sounds like you, stick around. We've got a lot of information for you. Now, the first thing, I have to give you guys a crash course into the sleep cycle. And basically, what it is, it's almost like a sine wave. I don't want to get into calculus at all, but just kind of up and down cycles of how we should be sleeping at night. And it consists of about 4 sleep stages, and one additional one will be REM sleep, or rapid eye movement. And to kind of get into that, we have to get into brain waves as well. So there are gamma, beta, alpha, theta, and delta waves going from most awake to deepest sleep. And we'll cycle through those different brain waves as we get deeper into sleep. And what we'll see is in stage 1, which is more of our light sleep, it's that first like 5 to 10 minutes of where you're kind of groggy, but you're still kind of aware of your surroundings. It's the transitional parts of our sleep. Then that'll lead into stage 2, a little bit deeper still, where our body temperature starts to drop and our heart rate starts to slow down a little bit. And this is where it's actually more advantageous to have a colder environment, or coming out of a hot shower and having that kind of rush of cold air over top of you. This actually feeds into that sleep too and starts feeding into those beta waves as well. So that's at least one bit of advice that you can get into, is the hot shower before you go to bed. But we'll see our body temperature drop. You don't want to go too far, otherwise that'll start to wake you back up because your body will start to worry about being too cold. But body temperature will drop, and then we'll get into stages 3 and stage 4, which blend together a little bit. It's just the brain waves are probably the biggest change with it. But the big thing that happens here is the muscle relaxation, almost like paralysis almost. Blood pressure and breathing will drop down additionally, but we're starting to release more hormones, like growth hormone. This is really the more restorative sleep that we're having, the repairing from our daily grind, basically. And then we'll actually start to climb back up. We're starting to get into stage 3, stage 2, and then we'll enter into REM sleep. And it's what's actually termed paradoxical sleep, because our brain is much more active, but our body is actually still paralyzed. And this is where that dreaming happens. And a lot of research shows that the more REM sleep that we have, the better memory that we have as well. So a lot of the theory is this is where we're working from our short-term and working memory into processing it into long-term memories. And if you've ever dreamed, which most people have, it's just where a lot of your day-to-day experiences and things from maybe your childhood kind of slip into your dreams years later, basically. And with that, with these cycles, it should be about 5 cycles as we sleep. So you want to make sure that you leave enough time to fit all the cycles of sleep in. And so the average person, the average adult, should be getting about about 7 to 8 hours of sleep, but probably closer to about 6 on average as most adults. 6 to 7. So most patients aren't really fitting in the proper amount of sleep there. And boy, is it easy for me to say, oh, you should get 7 to 8 hours of sleep at night. It's a lot more difficult in practice. So what a lot of patients will end up resorting to will end up being a lot more of sleep aids, medications, going to see their medical doctor, being prescribed various medications. And one that's becoming much more prevalent lately is Xanax. Most patients that are having sleeplessness issues are also dealing with stress, anxiety, panic attacks. And so one of the off-label uses of Xanax is for sleeplessness, insomnia. Now it's a benzodiazepine, so a certain type of drug that affects GABA in the brain. And so it does produce that kind of well-being kind of sensation, but there's more and more research that's coming out that benzodiazepines in particular are probably going to be the next opioid crisis that we're going to deal with. And the opioid crisis that we are dealing with now is coming from in the 90s. A lot of pain medications were more opioid based. And benzodiazepines are going to follow suit with that. So who's going to be having to be prepared for that? This guy. And another one that's very common as far as a sleep aid is Ambien. So this one is not a benzodiazepine. It's more of a hypnotic, which, okay. But what's surprising for a lot of patients that are on this, they're typically on it long term. I don't think I've met a single patient that's been taking Ambien for less than 6 to 12 months. But even on the prescription printouts for it, it says to take no longer than 2 weeks. Otherwise, it will actually start to affect your sleep, which we'll get into here in a little bit. Lunesta, that's more of a narcotic. That sounds great. Trazodone, that's more of working on serotonin and actually used more so for depression, but it's also, again, off-label use for sleeplessness. So again, we've got a lot of different sleep aids out there, a lot of different drugs out there, a lot of different classes. I'll usually see a lot of barbiturates being used. Patients who over-the-counter use like Benadryl, antihistamines, those are going to be more of the barbiturates. People drinking before they go to bed, wine, alcohol, same effects as any barbiturate. So with that sleep cycle that we're talking about, that'll get you into that beta, that relaxed brainwave sensation, but especially long term, and especially this is how it is with a lot of sleep aids and medications, they'll get you into that sleeplessness or the sleepiness, but they'll eventually start cutting off that deep restorative sleep. So patients will end up getting that 6 to 8 hours of sleep. That's more of what I call like a white haze. They'll be asleep, but they're kind of aware of their surroundings, but they still wake up not feeling very great about themselves. They'll get sleep, but maybe enough to get them by, basically. So we talked about a few of those drugs so far, and as far as the other side effects to it, I kind of hinted at it here a little bit, but dependency is probably the most common thing that I'll see with a lot of these sleep aids. So habituation. We'll see with almost any drug out there, the longer that you take it for, the less of a response that you'll get out of it, and the more drug that you need to get the same type of effect. Sounds very similar to somebody that is using opioids, heroin, or anything like that. You just develop that dependency, and it builds up from there, and you just need more and more of this medication, or you're just getting less and less of an effect out of it. Now, generally, the side effects of these sleeping medications are going to be oversleeping. At least initially, we'll be drowsy going into the next day. Usually this is one of the first symptoms that I'll see patients say, no, it's not for me. It's just making me tired the rest of my day, the following day after I take it, or it's just really interfering with me driving to work or doing my work activities. It's just not for me. And then that's where we can look into some natural solutions very quickly for these patients, rather than having to wean off of these medications. More long-term use of a lot of these medications leads into memory loss. So they're typically patients that aren't getting the 7 to 8 hours that is required with these medications. They're cutting it short. They're only getting 6 hours. And I have a theory that it might lead into Alzheimer's disease, just with that lack of REM sleep, especially developing later on, the longer that you're using these medications for. We'll see sleep apnea. If you already have sleep apnea and you're taking these drugs, it actually worsens the apnea as well. So then that becomes a concern. And then I've also had, or actually I've even seen people that have dealt with hallucinations with these medications, and that can be a very kind of scary thing if you're on the other end of it there. So a lot of these sleep medications have a lot of drawbacks to them, and oftentimes I find maybe self-fulfilling prophecy, but they don't work the way that they're intended anyways. So what I look at are starting off with more natural solutions to help out with that proper sleep hygiene. So obviously avoiding caffeine, everybody knows about that, or at least hopefully. Anything that's stimulating, we want to try and limit, especially as we're starting to wind down in our nighttime. Nicotine. Nicotine is also very stimulating as well. Gone are the 50s where smoking is supposed to calm you down. Nicotine is actually more neuroexcitatory, so it'll actually keep your brain buzzing even when you're trying to sleep at night. What I'll for a lot of my patients, the first thing that I'll recommend is a sleep schedule. It's actually most important of what time that you wake up in the day rather than necessarily what time that you go to sleep. Um, so staying consistent with your morning routine will feed into what time that you are feeling ready to go to sleep at night, and answer the call. When you feel tired, go to sleep. And with that sleep schedule, the drawback that I'll find a lot of patients will make is working 5 days a week. They'll wake up potentially too early in their day. We'll say they wake up at 5 a.m., let's say, getting 6 hours of sleep for the night before. And then Saturday comes around, hey, I've got the day off, I could sleep in. Then they sleep until 8 or 9 o'clock. They'll wake up a little groggy, but then they can kind of continue on with their day. And they do that for Sunday, and then Monday comes around, and then they're dragging again because now they can only get the 6 hours of sleep again. So they're developing a habit of waking up at 6, and then they disrupt it. And then it feeds into this sleeplessness issue. Your body doesn't really care if it's Monday or Saturday. It cares about getting that circadian rhythm, developing that sleep and wakeful cycle. So waking up at the same time, even on the weekend, as a drag as it might be, will actually help you develop better sleep habits through the rest of the week there as well. And then certainly avoiding late afternoon naps. There was a few studies out there that showed, especially for teenagers, getting a nap right after school from about like that 3 o'clock to 3:30 or 3:30 to 4 o'clock, limited to about 15-30 minutes, was actually a great refresher for them. They maintained a lot of the memories from what happened at school and better learning with that. But typically as adults, we don't have that type of education process that's going on. So we don't need those naps as often. And typically that nap will end up feeding into a poor circadian rhythm as well. Being asleep during the day doesn't really help out with our nighttime sleeping. And then one that in the technological age now that we deal with is light pollution. A lot of computers, phones now are dealing with or have comfort views like my phone does, or red light or blue light filters on computers, phones, and then you can even get glasses that are blue light filters that you can use throughout the night, especially darkened area. You're using a lot of lights in the house, just to at least block that, so you're still producing melatonin when you're trying to go to sleep. So getting that on at a certain time, maybe about like 2 hours before you're planning on going to sleep, or turning off all the electronics about an hour before you're going to bed, and keeping the light low for that last hour. That'll also help stimulate that melatonin and then get you to sleep more easily. And that melatonin is really what feeds into that circadian rhythm of going to sleep at night and being awake during the day. Now, failing all of these, looking into some supplements that will help out with patients. I've got actually quite a few supplements that help out with this. Starting off with Nutritional Frontiers, one product company that we use here. Two that I'll use primarily will be our Calm Day and our Sleep Time. Sleep Time kind of speaks for itself, great for sleep, and its dosing mostly focuses around sleepiness. The Calm Day, it's more so used for somebody that is stressed. So it's kind of like a natural form of that Xanax. I never pair it with the benzodiazepine because they'll feed into each other a little bit, and then we have to worry about toxicity levels. So I don't want to take Calm Day with the benzodiazepine. But otherwise, the Calm Day, it'll help kind of get us in a more relaxed situation using GABA or phenibut, depending on when it was made, basically. And then it utilizes taurine, which feeds into that GABA. And GABA is more of just that neurotransmitter that kind of drives that rest and digest, basically, that relaxation. The parasympathetic nervous system is what we're striving for. The sympathetic nervous system, the fight or flight part of the nervous system, that's what we're trying to down-regulate a little bit more. And then theanine also helps promote relaxation. That's in Calm Day and the Sleep Time. Glycine has been shown to be a great relaxer as well. 5-HTP is in the Sleep Time. It builds up serotonin. So with Sleep Time, I also avoid not only the benzodiazepines, but somebody that's on an SSRI, for example. We don't want too much serotonin, and then otherwise we'll have toxicity in that situation as well. The 5-HTP will help out with serotonin, produce that relaxation effect there for us, and it starts off at a small dose. We always want to titrate up if we need more serotonin. We don't want to go full blast forward if we can help it. But then the sleep time also has the melatonin in it. So again, feeds into the circadian rhythm, the sleep, and it's only about 3 milligrams. I've seen people take 10, 15, 25 milligrams of melatonin. That is way too much melatonin. The more of this hormone that you take, the less that you're going to produce yourself, and then you're putting yourself behind the 8 ball there as well. But then both of these vitamins, Calm Day and Sleep Time, also have B vitamins that feed into the coenzymes and a lot of the hormones that are produced during sleep. They feed into those as well. So it's important to have a good B complex there, and the Sleep Time and Calm Day provide that. Now, as I mentioned, as you probably picked up, if you're on a benzodiazepine or an antidepressant, really kind of eliminates one or both of these supplements. A lot of patients are on benzodiazepines. So then what I end up going towards is standard processes relaxers, Mintran, Minchex, and even Orchex. Minchex is a blend between Mintran and Orchex, so I'll mostly be talking about those two here. Mintran, gentlest one, it's just a short for mineral tranquilizer. Sounds a little bit more abrupt than what it is, but it's basically magnesium, calcium, kind of these ash minerals that are more alkalizers that'll help drive that parasympathetic nervous system. But then it also has sea kelp in it that'll have potassium, sodium, iodine in it, and these will also drive the parasympathetic nervous system as well. So it's a good way to kind of naturally tap into kind of relaxing the muscles with the magnesium and tapping into relaxing the nervous system with the other minerals there as well. Now the Orchex, on the other spectrum of it, it is probably the strongest one that we'll have out of like 100 patients that I'll have with sleeplessness issues. Probably 1 out of the 100 I'll recommend the Orchex just because it is that potent. But it's excellent for patients that are on antidepressants that are kind of, their top is already blown off basically, but also very great for postmenopausal women that are dealing with hypertension, or men that are kind of on that depressed spectrum with hypertension as well. But what it is niacin and B6. So again, those B vitamins that feed into that hormone production for sleepiness. But then orchic extract as well, so testicular extract that'll help heal the body as well. So you'll get more restorative sleep that way. Now the Minchex, it's basically just a 50-50 mixture between the Mintran and the Orchex combined together. So it's a lot stronger than the Mintran is. And generally this one, it is quite potent. If I have somebody that just has not slept well in months or weeks, Minchex is usually what I'll do. And I'll usually start off on a smaller dose of 1 or 2 at night. And if the patient wakes up groggy, okay, then we just half it. We just take 1 at night, basically. In very rare circumstances, am I having a patient taking it throughout the day? Again, that's probably a more depressive patient, where they need something that's going to help relax them throughout the day, and then they just need that little extra kick to help them get to sleep and stay asleep. So those are my 4, well, technically 5 recommendations as far as natural sleep supplements that we offer here in the office. What are you guys doing to help out with your sleep? Any old wives' tales that you're using, or tricks of the trade that you're using that really kind of knock you out? Warm milk at night always did the trick for me when I was a kid. But what's working for you guys? If you have any questions, certainly leave them in the comments below, and I'll see you on the next one. Stay healthy.